Hello everyone. Today I'm going to make an announcement. There is a lot of demand from my patients in particular and public in general. They want me to talk in English about various health topics. So today I thought it's a good day and I'm starting a new channel, and it will be called as Dr. Bhatt's Talks on Health Issues. Dr. Bhatt's Talk on Health. Okay, that much you can type. That will be my uh, identity regarding English channel. And as usual, my Kannada channel will continue. Today I have spoken the 75th talk of my talk series in Kannada. So now, how to start with? So I thought people who are a little more aware of certain technical terms, they will be able to understand certain topics. So I will be choosing topics depending upon the uh, particular person's ability to understand certain technical terms. Hope you got it. Okay. The first topic of this series is smoking. Smoking and its effects on health. This is a general topic. So, smoking, when I say smoking, it is smoking of tobacco. You know what a cigarette contains? Cigarette contains tobacco. BD contains tobacco. Or there are some people who chew tobacco in villages, and the government has made it. It is giving a statutory warning that smoking is injurious to health. That's all it says. So it is we people's responsibility, we doctors' responsibility to make you aware of the ill effects of smoking, be it BD, be it cigarette, be it cigar, be it tobacco chewing. Tobacco in any form is injurious to health. So you may wonder, yeah, this is a very ordinary topic. What is there to talk about it? Yes, there are a lot of things to talk about, but I choose to talk about a few points. Maybe this will last for about 10 minutes, that's all. So the smoke in general and tobacco smoke in particular, when inhaled, it goes through your throat because you smoke. It may pass on to the trachea. Some smoke may enter your stomach. As you know, trachea and stomach, there is a valve which opens trachea and closes the esophagus, mouth of esophagus. So when you swallow, it closes the trachea and it opens the esophageal orifice. So some smoke enters stomach and it may cause gastric irritation leading to gastritis. Gastritis, which later leads to, it may cause gastric ulcer. It's another topic. Here, if it enters trachea and hence the lungs, naturally the alveoli, that is the smallest unit of lungs, Alveolus is a small air sac wherein there is exchange of oxygen and carbon dioxide. Carbon dioxide is produced in the lungs. We inspire air which contains more of oxygen. Of course, it contains nitrogen and various other small gases, small amount of gases, but it is mainly 70% is oxygen. And this oxygen, when it enters lungs, in the lungs, there will be impure blood brought from the veins. The veins bring impure blood from the heart to the lungs, and in the lungs, in the capillaries, there will be capillaries in the alveoli, in the wall of the alveoli. So there will be exchange of gases. That is, whatever carbon dioxide is produced inside the body, it will be carried in the blood to the lungs by the veins, and in the lungs, the capillaries, in the alveoli, the capillaries take oxygen from the lungs. So oxygen is taken up and carbon dioxide is left out. So this mechanism happens in alveoli. So alveoli is the smallest unit of a lung. If tobacco smoke gets inside the lungs, naturally it damages the alveoli. It may also damage the bronchus, the main respiratory tunnel. As soon as you inhale, as soon as the smoke enters the trachea, a trachea divides into bronchus, and bronchus further gets divided into bronchioles. These are the pipes. Alveoli is the lung substance. To the lung substance, from the trachea through the bronchus, it goes to the lungs, bronchioles and alveoli. Lung is a tissue. It's an air bag. It's an air bag. Bronchus and trachea and bronchus and bronchioles are the conductors of air. The air passes through trachea, bronchus, bronchioles to the lung tissue. That is the finest, I have already told you, the alveoli, wherein the gas exchange takes place. So this alveoli may be damaged, but before that, the bronchus may also be damaged. The surface epithelium of the bronchus may be damaged, and that may lead to constant irritation of this bronchus or the bronchioles, may result in, again, a wound, a small ulcer, which later becomes carcinoma, that is cancer. So it may be a bronchogenic carcinoma, which is produced in the bronchus, which is present in the bronchus, or it may go to lung and damage lungs, and there may be a carcinoma of the lung. So carcinoma is the dreaded disease, as all of you know. If the bronchus gets destroyed, it is more dangerous because it's a main windpipe. It's more dangerous. Alveoli, it all depends upon how much lung is damaged. There is one small ray of hope for the smokers. If both the lungs are damaged, 100%, sorry, no chance of revival in spite of the various treatment which the cancer specialists, oncologists give you. For human being to survive, 50% of the lungs totally 50% volume. If retained, there is hope of living. A person can live with one lung. That means 50% of the total lung capacity. So this is the most dreaded disease. There is another disease which you have heard, tuberculosis, which nowadays is a bit rare, but in smokers, you cannot rule out this also. So anybody who has the history of smoking, we make him undergo various tests starting from chest x-ray to endoscopy to abdominal ultrasound scanning, because various things can happen at various levels. So tuberculosis, it's another matter, another, we can discuss it on another day. It is again it was a very dreaded disease once upon a time, but thanks to the vaccine we give to a baby on the second day of its birth, you may be knowing BCG vaccine. So BCG vaccine is given to prevent tuberculosis. So the child is protected. Even the adult is protected to some extent. But having said this, I have seen pulmonary tuberculosis in a few people. And of course, there is treatment. We give treatment. And this tuberculosis or the cancer, it need not occur in only a person who smokes. That is why the government's warning. You cannot smoke in public places. What does it mean? It means that when you smoke, you let out, you swallow some smoke and you let out some smoke. This smoke which is let out is inhaled by the nearby person or the public, or in your house, your wife, children. Yes, they may get affected. It has happened. It has happened many times. In my experience, I have one particular case which I can quote now. The husband was a heavy chain smoker. He smoked and smoked. I was telling him, you are going to smoke to your death. But he was just smiling. Sometimes the verbal assault will not work with patients. They have to suffer, then they will understand. But here, the paradox was, nothing happened to this man, but his wife died of carcinoma of the lung cancer. This is a classical case wherein his wife was punished not for her fault, but for her husband's fault. This has happened. So, guys, be careful. Nowadays, even the girls smoke. So, please, girls also, please be careful. You are an active smoker, but other people becomes passive smokers and you may damage other people's lungs. So, please don't smoke. Don't smoke for the sake of your health. Don't smoke inside your house or in a public meeting or somewhere for the benefit of others. That is why they have totally banned smoking in trains, in aeroplanes, in buses. They have banned smoking. So people will have their own avenues to smoke. Now there is an electronic smoking and whatnot, e-smoking. Well, it's one's choice to live or die. So I leave it at that. Thanks for listening to me. Please subscribe to my new channel, Dr. Bhat Speaks About Health. So that is the channel's name, and I will be talking various health topics periodically. Bye.